But thank you so much for joining us today. I'm really looking forward to talking to our panelists. I think I'll just give it a few more seconds and then I'm going to get started properly. I think we've got a good crowd here. I'm going to get started. So, hello everyone, and welcome to Babylon's Men's Health Awareness Virtual Q&A. My name is Scarlett Wrench, and I'm going to be today's host. Thank you so much for everyone. It's really great to see so many people here. So I will shortly introduce you to our three brilliant panelists. So as most of you will know, the month of November is dedicated to raising awareness of and funds for men's health causes. You might know it a bit better by the name Movember and the associated moustaches. And in particular, this period is focused on the issues of prostate cancer, testicular cancer, and men's mental health. So I'll tell you a bit about me. For the past 3 years, I've been the features editor at Men's Health magazine, and I've been working with the magazine for almost 10 years in total. So this is an issue that means a lot to me personally, and it's also one that I know would benefit from greater awareness. I would just like to point out that this event is live, so if there are any technical issues at any point, please bear with us. We'll get them sorted as quickly as we can. So before we start, I wanted to share a few somewhat sobering statistics with you. Some of them might be statistics you've heard before and some might not. Men are more likely to die prematurely. In England and Wales, 38% of all male deaths occur under the age of 75, which is compared to just 26% for women. Men are 35% more likely to die from cancer than women are. And of cancers that affect both sexes equally, that rises to a 67% increased risk. Men account for 3/4 of all deaths by suicide. Suicide, injury, and overdose remain the most common causes of death for men under the age of 50 in the UK. So today we want to look at a few of these issues in a little more detail in the hope that it might benefit you or that there might be something of benefit for someone you know. So at the end of our panel discussion, we will also be running a live Q&A. Please message our hosts via the Zoom chat function if you would like to ask a question, and we will pass those questions over to our panelists. If you do miss anything, don't worry, because we are recording the event and you can request a copy as soon as it becomes available. So without further ado, please let me introduce you to our panelists. If you would like to give us a wave, Dr. Keith Grimes. So Dr. Keith is a medical director at Babylon Health and an NHS GP with almost 20 years of experience. He's also pioneered work in the fields of clinical VR and AI. Next, I would like to introduce you to Dr. Mark Pereira. Please give us a wave. So Dr. Mark is Babylon's Clinical Digital Health Director and LGBTQ+ Committee Chairperson. His areas of interest include lifestyle medicine, health technology, sexual health, and men's well-being. And finally, Bethany Thacker. Bethany is Babylon's US Behavioral Health Lead and is a clinical therapist as well as a certified substance use counsellor. So I'm going to start by addressing a few questions to Bethany. It's been reported that during the pandemic, symptoms of depression have doubled. For a lot of people, I think it can be very difficult to know what depression looks like as compared to the very normal reaction that you would get from a situation like this. A drop in mood is very much expected, but could you tell us a bit about what the difference is between low mood and what would be considered clinical depression?
Absolutely, that's a great question. Feeling down or low from time to time is just another part of being human. It can be a normal reaction to loss, disappointment, or a difficult situation. In these cases, feelings of sadness will typically go away on their own and doesn't impact the person's life in a major way. Depression, on the other hand, is a mental illness and affects your mood, the way you understand yourself, and the way you understand and relate to the things around you. It's much more than just sadness or feeling down. People with depression may feel hopeless, worthless, have a difficult time concentrating, have issues with sleep, mood lability, and can even result in having physical aches and pains. Depression can cause impairment with daily functioning, and that's that major red flag to know when it's going from low mood to true depression. And these daily impairments can be missing work, neglecting one's hygiene, and isolating from your support system.
I think during lockdown, particularly, when you can see people face to face and you see people every day, it's often much easier to spot the signs that there's something wrong. For people who might be concerned about a friend and not able to see them on a regular basis because of the lockdown, what would you advise, both in terms of how to talk to them about the problems and how to support them?
So signs your stress and mental health is being neglected could look like, low moods, feeling irritable, like I mentioned, trouble sleeping, isolating from your friends and family, or an increase in some unhealthy distraction techniques like substance use or even excessive social media scrolling. Feeling stressed and overwhelmed is exhausting. Most men tend to keep these feelings and emotions to themselves instead of opening up to those around them. This can lead to feeling more isolated and alone. If you're worried about a friend or family member, sometimes the best way to start those conversations is to open up yourself. Modeling that behavior can help fight the tired stigma that men should suffer in silence. So challenge yourself to be more honest about how you're feeling. And when you're talking to your friend and they ask, "How are you?" instead of trying to responding with the far too automatic, "I'm fine," being a little bit more honest and say, "You know what, honestly, I'm not doing very well this week. I'm having a really hard time adjusting to my new schedule and everything else that's been going around." The best way to normalize mental health is to talk about it. And having your friend or family member know that you are there, that they can open up to you is honestly have such a larger impact than some people might realize.
I know in some of the research that we've done at Men's Health magazine, a lot of people did say that the thing that would most encourage them to open up to a friend is having that person admit first that they were struggling as well. More so than even sort of the situation or the environment, just the simple fact of someone saying, "I'm having a difficult time at the moment," can be that thing that sort of opens that door for people. I know you mentioned that substance use was another issue that some people might be experiencing. Um, I think there have been quite a lot of jokes about everyone says they're drinking a bit more during lockdown, but I think sometimes those jokes can sort of belie a slightly deeper problem. We know that men are more likely to exceed the low risk drinking guidelines than women are. Could you talk a bit about different coping mechanisms and how to sort of identify whether your coping mechanism is perhaps damaging?
Absolutely. So, in general, difficult or stressful times seem easier to manage when there's that known end date. So, instead of spending our energy every day thinking of when will this ever end or when will things go back to normal, trying to pause and reminding ourselves what you are in control of versus what you are not, like when COVID cases will decrease enough for things to open back up. It's become ever more apparent that practicing self-care is just no longer optional for us. It's a must. We need to remind ourselves that it is okay to start prioritizing these mental breaks for ourselves. And this absolutely does not need to look like these magical 2 hours of meditation every single day. In my opinion, the best self-care activities are the ones that can fit into 10 to 15-minute breaks during my day because that's how hectic my schedule is. But it's also important to recognize when we are practicing more maladaptive or negative coping skills or distraction techniques like drinking or doing things that are actually causing us more harm and not helping to improve our moods. So trying to look at those and replacing some of the more maladaptive behaviors with positive ones. My favorite is listening to music. Sometimes I pop in my headphones even during the workday, during lunch, have a awesome impromptu dance party with myself and my dog. And another thing to recognize is to monitor your scrolling time. Filling our free time with our phones can be a great distraction technique, and it doesn't always have to be negative, but really watching to see how much we are being saturated with negative news feeds and maybe taking breaks when needed. The other really great thing to try and practice during a time like this is the art of reframing. And so if you're noticing having a lot of these negative thoughts, either about yourself or about the situation we're in, trying to stop it in the moment and reframe it and spin it into having a more positive light.
Yeah, I think that's such a great point because I think sort of particularly words like self-care can sometimes feel a little bit intimidating for people who kind of associate with that with sort of like an hour's meditation in the morning, scented candles and baths, and knowing that there are so many different options and ways to kind of keep an eye on your mood and make sure you're looking after yourself. That you know, they don't have to take up all of your time. It can be the really little simple things like dancing, like music, like hanging out with your dog, having a bit of fresh air if you can. So I think another thing that people have found quite challenging during this period is trying to find that balance between the rest and the restoration, as compared to productivity and that kind of that desire to fill every spare minute of your day with useful activities, which is something that I think a lot of people struggle with. So, Dr. Keith, I know that you've got your own experiences with that situation, with stress, with burnout, and particularly, you know, how those feelings manifest with men. Could you talk a little bit about your experiences?
Yeah, sure. Well, I'm very happy to. And listening to what Bethany was talking about there's so many things that she's mentioned that ring bells in my head now. But 3 years ago, back in 2017, when prior to being in my current job, I was working as a GP in a busy practice on the south coast of England, and I was leading the practice. I was treating my patients. I was running the place. I was like helping to commission care. I was doing a lot of tech stuff. I thought, this is it. I'd achieved everything that I should really be doing, but I should have been happy, but I wasn't. And this is one of the things that I think that maybe some of the people on the call will recognize as a sort of man. Sometimes you're expected to achieve, you're expected to do, and you're expected to just get on with it. And then when you've got there, that's it. Enjoy yourself. You've done it. But I wasn't happy. I'm Scottish. I've come from this sort of background of not really talking about my emotions at all. So when people ask how you're doing over time, you're like, no, I'm fine. I'm fine. You don't open up because you think that's the thing that you're meant to do, and it shows that you're coping. But what happens over time is that your ability to be able to express the distress that you're feeling goes. And this was very much me. I was working hard, and I was like, well, why am I not feeling good? I'm doing all the things that I should do. So I did something that I think is common for people as they start to get stressed and burn out. Is I started thinking, well, maybe I'm not working hard enough. So I started throwing out the things, all those things that Bethany's been talking about that make life worth living, that help you kind of feel better. I stopped doing the computer gaming and going out and running. I stopped doing those things because I should probably be working a bit harder to get over that hump. And I stopped speaking to people about it. I started to sort of suffer in silence. I started to sort of think about things at night. My sleep started to get worse. I couldn't get off to sleep, so I was thinking about things all the way through the day. And then I started to wake up really early and couldn't get back to sleep. And now I'm a GP. I've spent my entire career treating people with depression, anxiety, and stress and burnout. But when it's happening to you, you just can't see it. And if you're not talking about it, people maybe can't see it in you. And this is why it's really important for people to start being honest about themselves and, talking about their things, because when other people start talking about that, if they're not coping and you can see that, then you're going to maybe feel a bit more confident about talking about these things. Anyway, that didn't happen to me. I kept sort of taking all these problems like beach balls and stuffing them down and sort of keeping them all underwater and coping, and constantly ejecting other things that I couldn't do, until eventually I was left at this point where the only thing in my life that I was focusing on was work, and I hated it. And it got to a point where I couldn't keep all that stuff down anymore. One day, I just couldn't do my work. I couldn't make the decisions that I usually found so easy. I was in tears. I had to phone into work and say, look, I can't cope anymore. I'd kind of got to that point. I thought, what's happened that this has happened all of a sudden? And of course, it hadn't happened all of a sudden. It had been happening for months, maybe even years, that I'd been gradually getting weighed down and not talking about these things. And I was anxious, but I was also depressed. And like I said, I've been treating people with this. And for anyone who's on the call who is either currently struggling with anxiety, depression, or burnout, or has done, my God, it is horrible. I understand now. I treated people, but now I understood. And it's a particular form of torture that takes a long time to get through. And happily, I am through it now. And how did I get through this? I got through this through talking. Through admitting that I couldn't cope. That was the key to me being able to get better. Having the support of my wife and family, without which it would have been very hard, but also my GP, who turned out to be very, very helpful in this situation. friends of mine, some friends that I spoke to occasionally beforehand, became fantastic, constant companions to talk openly about this. And with that, and also the use of medication and antidepressants, cognitive behavioral therapy, things like this, I slowly started to recover, get back to work, at which point I realized that I need to change and joined a fabulous group of people at Babylon, of course. But I changed everything in that. But to stay well, I realized that I had to learn to talk again, because I'd stopped talking about my emotions. I'd lost the language of how to explain how I was feeling. I was either good or bad, but as time's gone on, I've got better and better. And now to stay well, I have to make sure that I don't drift back to the way I was, that I continue to talk. And that's hard because of how I'm raised and how society is, but it's changing. So I'd really want people to, sorry about that, really people to feel comfortable that it is okay to talk about these things.
Yeah, we did a big project about mental health in the workplace, I think about a year ago, and it was incredible just seeing how much of a response that got. I think roughly 2/3 of our readers said that their sort of working environment had at some point damaged their mental health. But I think, you're so right that there's such a conspiracy of silence in a way, where people feel like they don't want to be the person to say that they're struggling because, if they haven't heard someone else say it, they don't want to be the first person to put their hand up and say, actually, this is really hard.
And this is exactly why I'm talking about this right now. I was so unhappy, and with everyone's help, I've come back, and I absolutely refuse to let all that pain lead to another person suffering because they want to talk about this. I had depression, I had anxiety. Thankfully, I am in control of things right now, and you can get there. It's okay.
And I love that idea as well of sort of talking about mental health, almost being like sort of flexing a muscle. Like if you don't use that muscle, you start to lose that ability to kind of to communicate those feelings. And only through the kind of regular practice of using it do you kind of strengthen that ability to actually verbalize how it is you're feeling. Dr. Mark, I would love to ask you a question next. On this subject, do you have any advice for men who might be struggling to label or express some of the feelings they've been experiencing this year?
Well, absolutely. Like, as you said, it's about flexing that muscle. And so many men don't know they even need to do that until they need to do it, like they are in a lull. So many presentations of anxiety, depression are just not acknowledged. They come by surprise as men, often, in their late 20s, early 30s, particularly if you've never had it before. It's like, what is this? I was in clinic this morning, and there was a guy classically comes in thinking something is medically definitely wrong, and doing tests will reveal the problem. But actually, once we went through the assessment, we spoke about the obvious precipitants in his life. It was clear that his non-specific symptoms were probably mental health related. Picking three off the top of my head that I see regularly, it's like something stuck in the back of my throat. I constantly feel that, but then when I'm busy, I forget that, or taking deep breaths, but I can't breathe in right to the end. These are kind of pins and needles. Again, there could be definite medical reasons behind this, but often if you're getting these non-specifically and distraction makes them go away, often that might be a sign you should listen deeper and explore that a bit further. Again, Bethany kind of alluded to it, but so many men are good at plastering over these problems with kind of sometimes alcohol, drugs, self-medication effectively, particularly for those social situations. And ultimately, there is usually a precipitant. There's work, family, relationships. Sometimes it's a sexuality issue. I know I've been through that. So that's where I got my experience and calibrated my scale of flexing that muscle, as you really well put it. In terms of kind of, I would just urge men, like, don't ignore those feelings. Come and speak to us about it. In terms of like, sometimes it comes to the point where you're having like serious kind of suicidal thoughts or panic attacks daily, and it's got that bad. So just don't suffer in silence. I know it's a cliche, but the fact is, so many of your friends and family have probably experienced this as well, men as well. And that's why, kick it out in football. It's about talking about it. Don't presume that you're the only person in that room who's suffering with it. And smash the stigma. Come and speak to your doctor if you're worried about anything.
Yeah, absolutely. I'd love to touch on an issue you just briefly mentioned there. So I know you've done a lot of work with the LGBT plus community. And I think sort of in the same way that those societal pressures can sometimes prevent men from speaking about you know, their feelings or what they're struggling with, I think it can also make conversations around sexuality very difficult for a lot of people. Sort of from your own experiences and from other people who you've been able to counsel, do you have any advice for people struggling in that area?
Yeah, I would say, again, it's a sensitive subject, especially if you're not comfortable with kind of the LGBT spectrum, but you definitely can be if there is, like, everything else is going right in your life and maybe the relationship side is, you know, something you're questioning. I would say, you know, that could definitely be the precipitant. There isn't always one, but definitely in my case it was. You know, 1 in 10 people are accepted as being of the LGBTQ plus spectrum. The commonest age to come out is 16 to 17, but so many people don't for various reasons, as you've mentioned, kind of societal, cultural, religious reasons, so many reasons. Like, great example, Philip Schofield, you know, he's 58 when he came out recently. And then there was Gareth Thomas, the professional rugby player, and he was 35 when he came out, both married with children. It can present at, you know, any point, and it's being open to it rather than forcing yourself into a box that your family or your friends or society thinks you should be. You know, ultimately that can be the cause of so many problems, and bottling up, again, is never a good idea. Like, so many men I've spoken to just want that kind of Harry Potter sorting hat thing where they want to be told, right, am I gay, am I straight? But ultimately life and human sexuality is obviously a spectrum. We are non-binary in that sense. And, you know, some people want to kind of calibrate. So, for example, some people will come to me and say, you know, I've had a gay dream. Does that make me gay? No, not necessarily. But if you're, you know, not attracted to the opposite sex regularly, then it's probably worth questioning that and discussing it further with kind of friends or family or a doctor, because there are so many great, it is the 21st century, you know, and it is okay, and it's a normal human part of the spectrum. So don't be ashamed. Like, at Babylon we have like a really good LGBTQ support network as well, but look, it's only 10% of men. If there's anything that you're keeping down there, just face it head on and come and speak to us about it.
Absolutely. And then I think as well, on the sort of the physical health side of things, a lot of the pressures that sometimes prevent men from speaking about what's going on inside their heads. I think there's also less conversation about men's health issues, including things like male cancers. And those same sorts of feelings can sometimes mean that men present a little bit later with symptoms or have some hesitancy about visiting their GPs. So I know in the UK, roughly 1 in 8 men will be diagnosed with prostate cancer in their lifetime. Dr. Keith, could you tell us a bit about what the prostate is, and also which people might want to kind of keep an eye on their risk?
Yeah, sure. And just before I get into that, the point that you make about men not wanting to come and see their doctor until something actually happens is so true. They often come in and they say, I saw you once and then constantly seeing you afterwards. Women are much better at coming in to see the doctor along the way. So yeah, the prostate now, and actually, so prostate's a good example of this. Now, the prostate, for those that don't know what the prostate is, it's because you can't really see it in most men or people with prostates. It's roughly the size of this chestnut object here. This is a seed bean, but it's around about that big, and it's hidden inside your body. It's kind of wrapped around the tube that goes from your bladder to the outside world, and it's part of the reproductive system. It helps produce seminal fluids, so when you ejaculate, some of that fluid is produced by prostate, so it's a very useful thing. As men get older, what happens is it starts to get slightly larger, and as it starts to get slightly larger, it can cause some symptoms. Now, this happens to all men, basically all people with prostates. And it causes some symptoms that are more common as you get over the age of 40, particularly over the age of 50. And so that might be a weakening stream when you try and pee, or some mild incontinence or dribbling, other symptoms like that. The symptoms that you might want to go to the toilet more than once after you've been, or even being up at night. Now, that's common in men, but prostate cancer is when there's changes inside the tissue that are cancerous. Now, as we've heard from Scarlett already, that's not an uncommon cancer in men as they get a little older. But what's interesting about it is that prostate cancer, although it affects a lot of men, is something that actually doesn't lead to be the end of the life for many men. It's something that a lot of them die with as opposed to die of. That said, you should be on the lookout for the symptoms. So when men in their 40s and 50s start to have these symptoms, also if they start to have things such as, for example, burning when they pee, or blood in the urine or blood in the semen or any of these symptoms, it's best for you to go in and speak to your doctor so they can take some history, get some information about this, and maybe do an examination. And the examination is the thing that sometimes puts people off because they're worried about what the doctor will think. But when you have a prostate problem, the doctor will want to do a sample of urine and test it, but then they might also want to examine your genitals, the penis and testicles and scrotum, just to make sure there's no problems there, and then examine the prostate itself. And because the prostate isn't on the outside of the body, the way that we examine it is just on the inside of the back passage. So a doctor will put a glove and some gel on their finger, place it into the back passage up into the rectum, and then feel just on the front to feel the shape and size of this prostate. And people might not have had this happen to them before. It's something that doctors do very, very frequently. So never let embarrassment about what the doctor might think stop you going in and having this conversation.
Yes, and I think, especially now with, various parts of the UK in lockdown and with the pandemic, I think there's a lot of additional hesitance about going to the doctor when people are concerned about something. So I don't know if you just want to say anything about what you would say to those people who might be worried about, booking in an appointment with their GP while the pandemic is ongoing.
Yeah, well, look, I mean, the first thing to say is I understand that if you've got something you're worried about, that you maybe don't even want to address it, and then the lockdown comes in and you think, well, they've got other things to deal with. Just start with the basics. General practice is open and we are still seeing and speaking to patients. Right now, we're taking a wee bit more care about how you do that. So at Babylon, we do video and phone consultations first. You should still do that because there's a lot of questions that a doctor might be able to ask. The things that you think might be related to your prostate may not be related to your prostate. So make that conversation or have that discussion. And then if you do need to be seen face to face, doctors, nurses, everyone is still seeing patients. They're taking a few more precautions. They might want to wear a few extra bits of clothing when they see you if they come in, or maybe bring you in at a certain time, but you can still be seen. What you must not do is sit at home and worry about it and put it off thinking that we've got better things to deal with. Dealing with your health problems is exactly what we are here for. This is one that we can really help with.
Thank you. Dr. Mark, so testicular cancer is something that's not perhaps as common, but it is something that does sometimes affect younger men. I think, for a lot of women, sort of doing regular checks becomes a part of their routine. But obviously, it's just as important for men. What sort of checks should men be doing and what sort of signs should they be looking out for?
Sure, you're absolutely right, Scarlett. So testicular cancer is the commonest cancer of younger men. But the best thing about it is it's a really good prognosis, really treatable. In terms of classically, it does present with testicular symptoms like a lump or unexpected pain on a regular basis. So the best thing you can do is self-check. And you're right, women are, I'm generalizing, but we're better at checking. But the best thing is learn from that. Like in the shower, that's the best time when, you're wiping around that area anyway, to kind of just literally feel the outline of the testicles while you're soaping up. There's a really actually good video that goes through it sequentially on our website by Dr. Claudia Pastides. So I'd refer you to that. But ultimately, we've got to remember that testicular cancer, there isn't like a national screening program for it. You can't really do that. It presents and you usually examine and send for an ultrasound. Just make sure you know what's familiar to you. So just I know it's again a bit a cheesy claim, but just get to know yourself a bit better and the contours of your body, because then if something is abnormal, you'll then know it. I would echo what Keith has said, which is, don't let it fester. I was in clinic this morning and I had to do 2 testicular exams. It's so bread and butter for us. We're not worried. Although it's, an intimate part of you, we will treat it with absolute respect and sensitivity, but it's literally just like any other patient we might see. So don't feel embarrassed about it. Be it, a finger in the back passage for the prostate or the testicles. It is all, our day-to-day. And the earlier you get checked, the better the prognosis in any of these conditions. So please do come and see us.
Yeah, I think that's such a great point. And getting to know what's normal with your body, I think, is so important. So changing the subject ever so slightly, I know that there have been a lot of media reports about an increase in concerns around erectile dysfunction with younger men. And this is sort of a question for both you, Dr. Mark, and for you, Bethany, from a psychological standpoint as well. But I think, with this, it's become easier than ever to get hold of erectile dysfunction medications online. Sometimes by sort of more what's the word, regulated means, and sometimes, you know, drugs that are perhaps not regulated. So, I mean, what are your thoughts on how much of a concern this should be for younger men? And, you know, perhaps from a psychological standpoint, what might be causing this anxiety? I'll pass to Dr. Mark first.
Sure, yeah, definitely. I'll let Bethany will definitely do that psychological part, I'm sure, much better than I would. In terms of, yes, you're absolutely right. Because of cookies, you know, internet programs which can allow you obviously to learn your demographic, your gender, there is so much like targeted advertising now for, you know, be it classic little blue pill Viagra or testosterone now, you know, that, you know, it's just a push for kind of sales to, let's take this will make you feel better. But ultimately, you know, erectile dysfunction is a relatively common, it's expected in terms of after certain age groups, there is plenty of pathologies why it happens. But if you just medicate with something that you've got without speaking to a doctor, you're very likely to brush that under the carpet. You might have a temporary solution, but you won't actually assess the underlying cause. And broadly speaking, I won't go into all the detail. I'm actually doing there'll be a blog later this month on our website, but there are, you know, two broad categories. There is medical, so there is a cause like diabetes or low testosterone, sometimes certain drugs, or it's psychological. And, you know, the majority of times in younger men below the age of 40, it is an element of psychological, be that depression, anxiety, performance, porn addiction, you know, so many things go into it. In terms of what I'd say again with that is, come and speak to your doctor about it rather than Googling it, because, you know, Google will always tell you the worst things. Oh, you've got penile cancer, or, you know, it'll just tell you the worst kind of thing, because, you know, that's how search engines work. It brings things which have been talked about a lot more to the top. I'm going to pass on to Bethany, but in terms of all, I would say it's a sensitive problem, but again, we're used to talking about it, so please do come and see us. Over to you, Bethany.
Sure, and not to sound like a broken record, but for the psychological kind of aspects of ED, the great place to start again is working to break down the stigma that men shouldn't talk about their feelings and emotions. Negative thought patterns and stress levels that go unchecked can lead to the physical symptoms like aches, pains, and even ED. So starting the conversations or dialogues with our partners, support systems may seem daunting, but it can allow for so much relief once we do. And instead of bottling down any of that stress, past trauma, or anything else that may not even be as acute, that lives in the body, and then that can come out in those physical symptoms. So talking about it, again, with everything else, you may be surprised to learn that other people around you have experienced similar things, or it just takes that open dialogue between you and your partner to sort through maybe some of the hesitations or stressors that you're feeling when it comes to the sexual activity or other.
It's another man thing as well, isn't it, Bethany? And again, I'm sure, Scarlett, in your articles as well, you see this. It's like, you wouldn't dare talk about that even. You know, low testicles, prostate, that's even, you know, considered worse. Wouldn't talk to another guy about that. I'm having problems there. But yeah, a number of people already have. So you'd be hopefully opening up someone. But if not, at least, you know, come to us, because it is something that we're happy to speak about. And the truth sets you free. Like, even just so many men I've seen in clinic, the moment they've opened up to a human being, you know, it makes them have a weight off their shoulders, and they can kind of approach things with a bit of a fresh attitude as opposed to catastrophizing.
Yeah, absolutely. Dr. Keith, did you want to say something? Or
yeah, no, I was going to say, it's like traditionally men will not admit to other men that they're having problems getting an erection. I understand that. And sometimes speaking to friends or family or even your partner about this can be a very, very difficult thing to start with. Now, whilst ultimately discussing this is going to be helpful, it can sometimes be most helpful to come and speak to someone you don't really know. So coming to speak to a doctor, a nurse, or a therapist about this, a person who isn't immediately related to you in that matter, could be a good way into things as well. So do bear that in mind, because it's not often that your friends will be such good friends to admit that they're having problems in that regard. And then you end up with a lot of pressures about what you should and shouldn't be doing. Pornography has a role to play in this as well. And if there's one thing that will kill an erection stone dead, is pressure and expectation. So yeah, trying to get some realism about it can be really helpful.
Yeah, absolutely. I think so much of this comes down to those sort of that self-stigma and those internalized feelings of shame that just don't need to be there. So I think we're going to move on to some questions now. We've already got a few. So I have a question here for Bethany to begin with, which sort of touches on some of those issues around depression that we were speaking about earlier. How would you support someone that you suspect is suffering from depression, but who doesn't want to talk about it? Which must be incredibly challenging. What advice would you have in that case?
And I think, again, I think I touched upon it before, but honestly, just being that one to open up the dialogue. So then that way the friend or support system that you're trying to reach out to just knows that they truly could open up to you when and if they're ready. It becomes very almost daunting for us as the support system to feel like, I don't want to overstep, or I don't want to make things worse. And that can kind of be a misconception, especially when the depressive symptoms are escalated to the point of you're worried that someone may harm themselves or thinking about dying or feeling that hopeless. And just to know that by asking people about it will by no means escalate the situation or make things worse. It can only help. You're going to be breaking down those walls of potential shame or isolation by reaching out. And it doesn't need to look like some huge elaborate conversation that involves a lot of medical talk or therapeutic talk. It could just be like, I've been noticing that, you haven't been reaching out as much, or, you're being a little bit more quiet. Is there anything going on you want to talk about? Just know that I'm here. And even just kind of laying that groundwork can allow that person to be like, you know what, I can open up and talk about things. But if it gets to the point where the symptoms are too acute or things are going on that maybe you feel like you're not equipped to handle, even just offering assistance to work through the process of getting them connected to a professional can be that kind of support system. And the best way I know to talk about the difference between sympathy and empathy is a visual analogy. If your friend is feeling depressed, imagine them in a deep, deep ditch. Adding sympathy would be you peering over that edge and being like, it's going to be okay. Look on the bright side. We'll get through this. But empathy is you getting the ladder, climbing down into that ditch and being like, let's figure out how to get you out of here. And I think that's really important for all people, but especially for men, knowing that, sometimes our friends really do need that empathy. But again, if you feel not equipped, then connecting them with a professional whose job it is to provide that type of support and empathy can be the best route.
Yeah, of course. I think that's such a great analogy, the one about sort of peering into the trench. And I imagine for a lot of people, just knowing that someone's noticed and is available will probably make a huge difference, even though you can't necessarily force someone to get help or force them to change the way they feel. You can at least let them know that you're there and you're not leaving. So we have another question here for Dr. Mark. How often should I get checked for sexually transmitted infections? What would your answer to that be?
Good question. So if you are sexually active and you have casual partners, then generally the cadence of having testing should be about 3 to 6 months, because that's usually kind of detectable if you've been exposed in that time, and that's why we go for that. In terms of, obviously, if you've got symptoms, don't hold on, go to an STI clinic, or you can get those home testing kits as well, like great for lockdown. I think it's really important to note, though, even if your partner is using contraception for pregnancy or PrEP to prevent HIV, you still can get STIs. So please use condoms if it's appropriate in the sex that you have. The last thing I'd say that a lot of people don't realize is that STI clinics are totally separate to GPs, confidential. So anything you might say in your sexual behaviors to an STI clinic doesn't enter your main NHS record. It's not going to get to your family. If you've got like a family contact with your doctor, don't be scared. Just practice good sexual health.
Great, thank you. And another problem that I think a lot of people worry about is sort of a decline in sex drive, and the kind of the fear that that might be an indicator of a larger problem. What would you say to someone who, this could go to Dr. Keith or Dr. Mark, but or Bethany, whoever, just put your hand up if you want to answer it. But yeah, to someone who perhaps has experienced a decline in sex drive and doesn't know whether this is normal or something that they should be concerned about. Dr. Keith, what would you say to them?
Well, it's going to be a common theme here, but finding someone to talk about it. And again, speaking to a doctor or someone at the practice might be useful here. And the reason for that is that so many different things that can affect your ability to, or your libido, your desire to want to be sexually active or to be close to other people. It could be a physical problem. So quite often people will come, when I've seen people come in talking about problems with that, they sometimes say, I'm having problems, I'm not finding this happening. Is it because I've got an underactive thyroid? Thyroid, a gland in the neck, and when it goes down, it can affect that. And that's partly because people sometimes perceive it to be okay to have a physical problem causing this as opposed to anything else. So yes, there are some physical problems that can cause it, but they're less, in truth, they're less common than other things. And Mark said earlier on about depression, anxiety, things like that. Those are going to have a fairly profound effect on your desire to want to get close to people as well. So coming in to see a doctor can at least begin to sort out the physical from the non-physical. Both totally legitimate reasons to have this happen, but it can be difficult to work this out yourself. Mark, sorry.
I'm just going to add, no, completely agree with you. Sometimes it's used called in the media, and more so by advertising companies, menopause, and it's basically, testosterone reducing. That is a natural course. Some fringe people, there is a cohort that have hypogonadism, so that's when your testosterone does drop below a healthy level, and you might require substitution, but it is rare, and so many kind of advertising companies might want to make you take testosterone. That'll be the solution to all your problems. You'll feel more masculine, you'll have a better sex drive, everything. But that's not necessarily the case. So if you are concerned about anything like thyroid or testosterone, come and see us. Over 40 anyway, you have an NHS health check blood test for basically diabetes and lipids. We would add that. So come and see us about it if you're worried.
Yeah, and as you said, I think, a lot of people probably, if they suspect that there's something wrong, or they have sort of seen these targeted ads for hormone replacement therapy or testosterone or sort of steroids that you might be able to get hold of online, that weight on your mind that there might be something wrong with you could probably be so easily alleviated just by having a quick conversation with someone who can support you if you need support, but also might say that everything you're experiencing is totally normal and totally fine.
It's just knowing you're not
Absolutely.
the only person in the room who has that and is feeling that, and it's putting it in context. That's what it does.
So if you want to ask any questions, please do just send them in to our hosts, and I will not read out any names or anything like that. Please feel free to share with us. So another talking point, obviously, this year people are more concerned about immune health and trying to stay healthy in that sense. Would any of you like to talk a little bit about ways in which people can keep their immune system healthy and make sure that they are in the best shape that they can be to stay healthy throughout the winter?
You go for this, Mark. Do you want to go, or shall I go?
I'll start. Yeah, sure. So
you start, and then I'll go next.
I'm going to sound a bit like a grandma, but start with the basics. It is rest, or grandpa, so I'm not going to say all on just the women there, grandma, grandpa, whoever, grandparent. In terms of, I would just say, it's the sleep well, plenty of fluids, a healthy diet, exercise within reason, and maybe a supplement of vitamin D. We've heard all about, particularly in coronavirus, how studies have shown, it's not completely conclusive, but studies have shown that people with high vitamin D levels are more resilient. And a multivitamin with omega-3 oils, all of the kind of the normal things, as well as avoiding kind of stretching yourself, burning the candle at both ends. And again, listening to your body. If you are feeling kind of glandular and starting to get unwell, just maybe stay in that day. Well, again, we're all staying in, but don't go too wild, basically. I think it's practicing work-life balance. That's how I would say boost your immunity. It's the basics. But Keith, go ahead.
Yeah. I mean, it's like anyone who tells you they can give you something that's going to boost your immune system is trying to sell you something for the most part. The immune system is one of the absolute marvels of nature. It is insanely complicated, and it does its own thing, and it does such things beautifully well. So what you have to do is stop yourself getting in the way of it. And everything that Mark said right there is exactly right. All these things in moderation, to put in there as well, right now when people at home, if you drink a lot, that can affect your immune system. If you take certain drugs, it can affect your immune system as well. So just to add that on top of the other things as well. And it's just really about moderation here. It's the same with exercise. A large amount of exercise can impair your immune system, but a modest amount of it can do so. I also want to remind you that the way that you feel and the way that you think also affects your immune system, are not in some sort of like hokey way. When a person is depressed, it can impair their immune system. In fact, there are some theories to suggest that it is related to immune system function in the first place. So maintaining good social relationships, talking about your emotions, trying to keep yourself well, all of that will help improve your immune system too. So not much more to add on top of that, and there's no miraculous stuff. I'm sorry, I can't tell you about something else, but then equally I'm not trying to sell you anything here just now.
I was going to add one last little thing. Sorry, it's just that immune system and World AIDS Day is coming up on December 1st. Obviously, if you are genuinely concerned that there's any risk factors why your immunity is low, come and see us. HIV test you can get readily done. It is no stigma about it. Please come and see us if you have any worries about that. Sorry, back to you, Scarlett.
Bethany, did you want to say something? Please
sure.
go ahead.
And I was just going to have a high level, therapy perspective on the immune system topic. But, at the end of the day, it's kind of similar to what Dr. Mark said is, you really just need to take time to get to know yourself and know what's normal and have those check-ins and being like, how am I doing? And that can be physically and it can be mentally. That can be, checking my stress level. Am I, sometimes you scroll through social media and it's like, reminder, unclench your jaw. And you're like, or straighten your back. And you kind of recognize like, oh, wow, like I didn't realize I was tensing my shoulders the whole time I was sitting here, or I was clenching my jaw. And so take those times, they say take, breaks to do deep breathing. And that may just seem like, us therapists trying to force this, this exercise on everyone. But in reality, it really does have a strong purpose. And that means take the time out, ground yourself in the present moment, and check in with your body and figure out, what's going on, and are my stress levels too high? Do I need to get those in check? Cortisol levels can impact how your body's feeling, your gut health, and everything like that. And although exercise, I'm a big, person who does daily exercise, but with COVID and lockdowns, and that can become tricky, recognizing that your diet and the things that you're putting into your body, as well as your water intake, can have a huge impact on your health and how your body's feeling, as in regards to that too. But sleep, my caveat of what you should be recognizing, sleep is more important than people realize.
Yeah, I think people are, excuse the pun, waking up to just how important sleep is now. I think, that's been such a big talking point for us. And I think, exactly as you said, I think there's such a tendency for people to see the mind and the body as two separate entities, and not to kind of recognize, the ways in which we carry stress in our bodies and the sort of the interplay between the two of them. So I think, that holistic approach is so important. So unless we have any more questions, I think we might start to wrap things up, or if any of you want to add anything else before we finish. But thank you so much to everyone who's joined us. Keith, would you like to add something?
Yeah, it's just something that we didn't explicitly cover along the way, but one of the ththings that happened to me when I was unwell is when you are unwell with depression or anxiety or any number of different things, you lose the ability to see truly what the situation is. You end up kind of lying to yourself a little bit as well. And so I'm talking a lot about talking to people. I just want to say that it's okay to admit that that's actually quite hard to do. It's not as easy as saying that. For me, it was the fact that I thought that I wasn't worth helping. It sounds like another thing to say it now, because now I feel differently. But depression lies to you about your own value and about whether you should be burdening other people or not. Now, I say this because you might be in this place right now with this, and it's a horrible place to be. This is why it's so important to be a good mate and a good friend, because a person may not have the energy, they literally can't reach out. And the ability for someone to ask can be that little hand down to the ditch, like Bethany's just said, saying, you look like you're struggling down there. Do you need some help to get out? Because sometimes people just, for whatever reason, can't do it themselves. So, you know, this is why it's important to try and reach out to. So the one thing that we hadn't particularly covered, I wanted to raise.
I was going to say one last thing as well, in addition to that, which is exactly right. Reach out. And if you want to reach out to us, I think our kind team have put events@babylonhealth.com. I consult digitally and physically at Babylon as well. And all of us do elements of that as well. So please do reach out if we can help any further.
Great. Well, I think we'll conclude things there. But yes, events@babylonhealth.com. And thank you so much to all of our panelists. I found this really insightful and really helpful and very interesting. So, and thank you very much as well to everyone who's joined us with Babylon today. It's great to see so many people signing in, and thank you so much for joining us.